Big data in healthcare emerges as a technology that can revolutionize medicine and the way to manipulate relevant data from patients, professionals, and employees. In this sense, a technology that allows analyzing large amounts of data in small periods of time, with greater efficiency and assertiveness, presents itself as an important ally in the modernization of health. Big data definition. The concept emerged as an attempt to name large amounts of information, which are generated every second. Over the last few decades, every known industry has been bombarded with data, showing amazing exponential growth. This information is spread across numerous platforms, systems, and digital environments, and makes up financial, social, professional, and personal relationships, from small interactions on the internet to inscriptions and records that guarantee the existence of individuals in the virtual environment. However, experts were not able to measure the amount of information that grew every second, thus creating the concept of big data. With it, there are also tools that allow not only to structure and identify relevant information in considerably large volumes of data, but also to use these results assertively. Variety. Still, variety is also in the different formats and types of data that you need to evaluate for decision-making. For example, in big data in healthcare, it is possible to have structured and unstructured, numerical, personal data, or even third-party notes. Speed. Data is getting denser as it becomes more important to perform efficient analysis with as little delay as possible. And with the emergence of new interaction and communication technologies, the tendency is for new volumes of data to appear for analysis. And it is important that the tool that allows the structuring of these references is fast enough. What is the role of big data in medicine? This technology is used to analyze large amounts of data at a higher speed than conventional systems, looking for useful and structured information. This is about 5,000% more than the volume of information in the last 8 years. In this way, it becomes necessary to have a tool that can evaluate and consider this amount of data efficiently, such as big data in health. Quality in analysis. In addition, much of the importance of this tool is not in the volume or demand assessed, but in the way it allows data to be managed. However, added to other structured data, it is possible to obtain significant results. For example, a big data system in healthcare can evaluate hundreds of patient data and find a diagnostic pattern, which speeds up the care of other individuals with the same profile. If a professional has a suspicion but needs concrete data to prove it, technologies like this make it possible to use large volumes of archived data to form a solid basis for their assessments. How does big data work in healthcare? Despite knowing the concept of big data in healthcare, some managers may have doubts about how it works in practice. The analysis of large amounts of data, in an efficient and agile way, as is necessary in big data, depends on the use of specific software and programs for this. The next step is to manage the data that will be evaluated, be it an internal database or a set of information in the cloud, for example. Finally, big data will return data from what was specified earlier. For example, if a professional wants to know which patients of a certain profile presented a symptom, the system will seek to list and find this data, to present them at the end of the analysis. The possibilities are diverse, using big data in healthcare. Cost reduction. However, its software can perform these and other practices in just a few minutes, significantly reducing the costs that the company could have to manually evaluate the same amount of data. Accuracy of diagnosis. Currently, there are technologies that use artificial intelligence to evaluate reports and draw a diagnosis based on a database. For example, the software evaluates the patient's report and, when it finds other relevant data in its analysis, can compare them and make the diagnosis more accurately. These and other possibilities depend on evaluating large amounts of data in a depth term and in a structured way. Assertive decision-making. This is because it allows for more assertive decision-making based on data found in a relevant analysis. For example, by gathering and evaluating strategic service information, managers can identify which actions yield the most results. Personalized and humanized service. Also, big data in health also contributes to a humanized and personalized service for patients. With the reduction of time to evaluate the data of reports and exams, it is possible to dedicate more time to the service, making it more assertive and understanding. How to optimize resources with big data in healthcare. Of course, there are some recommendations that can help you optimize big data in healthcare, being able to leverage its tools more fully. In this way, it will be possible to carry out the evaluation of the information in a complete and assertive way. If the software is concentrated on only one platform, for example, they may not perform an assessment on all databases. Thus, it will be possible to take more advantage of big data in healthcare, searching the data in all possible systems for complete results. These are the indicators that enable big data research in health. Information privacy. Information shared with healthcare professionals must meet certain privacy criteria, especially as they are sensitive and confidential. GDPR. However, these restrictions can also hamper the efficiency of big data in healthcare, since it deals with sensitive information directly related to patients. Adequate infrastructure. Meanwhile, the infrastructure of clinics and hospitals can also be a challenge for the implementation of big data in healthcare. However, not all healthcare environments have adequate structures to put big data into practice. Can big data in healthcare optimize time and revolutionize current medicine? Finally, even with the challenges faced today, big data in healthcare is a technology or a strategic analysis mechanism, which can revolutionize current medicine. Thus, big data in health offers positive impacts in various niches of medicine and proves to be a powerful ally for the automation of processes and for the modernization of medical practices, from simple routines to complex decision-making.